What if there are things that you can do to reduce your risk of Alzheimer's and other forms of dementia? Hi, I'm Dr. Z. I'm known as the brain guy. So let's talk about some of that, right? Is there one thing that works for everyone, or is that really a faulty approach that's ultimately going to set you up for failure? But first, let's go into, right, before you get Alzheimer's disease or other forms of dementia, you'll typically go into a state called mild cognitive impairment. Mild cognitive impairment is where your memory's off more than, occasionally walking to a room and forgetting why you're going in. But it's where, friends, family, maybe your coworkers are noticing it and it's impacting your life to a higher degree, but you can still take care of yourself. Once you can no longer take care of yourself, that's when you've tipped into Alzheimer's or other forms of dementia. And if you are watching this video, that means you are either worried about one, being in mild cognitive impairment and heading to Alzheimer's, or two, you have a loved one who you are worried about. So, what do we do? How do we approach this here at the clinic? Part of what I'm going to do is I'm going to share my screen because there are some of the things that I really need you to understand. Traditionally, from a medication standpoint, there's really not a lot that's done. There's donepezil, which is also known as Aricept. There's Namenda, memantine, which is used more of in Alzheimer's once you're more moderate. Not necessarily. There's nothing preventative. So once again, there's really nothing preventative they do for you. So is that really what should be happening? So I'm going to share my screen. And first, let's look at this, right? So this is a research article that's published by JAMA, so Journal of the American Medical Association. As you can see, it's May 2022. So depending on when you're watching this, there may be some new research. But this is a systemic review and a meta-analysis. So that means this is the highest level of research. This is not one research study that was done and cherry-picked. This is where they looked at a variety of studies to say what was going on. Now, it's associations of multiple domain intervention. So multi-domain means different aspects, right? So we can say one domain is nutrition, one domain is exercise, one domain is cognitive-based therapies, right? So each one is a domain with improvements in cognition, mild cognitive impairment. So, right, so basically they're telling you from this title that they say with a multi-domain intervention, people are seeing improvements with mild cognitive impairment. Now, what they did was they looked at a ton of stuff, but here's what they found, right? Multi-domain interventions were more strongly associated with improving global cognition, such as memory, executive function, and verbal fluency in older adults with mild cognitive impairment in single interventions. Now, at the end, you see the but evidence is needed, and that's really is, depending on the research, some of these were done for a month, others were done for a year, and we don't quite yet know that sweet spot of what should be done. Here's another study where they did aerobic exercise, and this was with early Alzheimer's disease. So this is even people that were diagnosed. And then they said 26 weeks or 6 months of supervised aerobic exercise and how it impacted memory, executive function, and functional ability, as well as depression. What they found is that it improves functional ability and it helped, once again, memory, and it reduced hippocampal atrophy, which is awesome. So your hippocampus is one of the parts of the brain responsible for learning and memory. And we see that atrophies in Alzheimer's disease. So if you can reduce hippocampal atrophy compared to what should have been happening, that is actually a really big win. So this is stuff that's been hypothesized for actually a while now, that we can stop or slow the atrophy within the brain, even though it's only been more accepted recently that maybe you can do that, right? So that's where it's getting acceptance. So don't just roll over and say, oh man, I've got mild cognitive impairment. There's nothing I can do. I'm going to Alzheimer's disease. That's false. And also don't say, oh man, I've got early Alzheimer's. There's nothing I can do. As you saw, there is a window of opportunity. You must take it. If you wait, I do unfortunately have to turn down patients who want to come to me too far in the game, because treating Alzheimer's disease is like a raging forest fire. You've The more trees that get burned down, the harder it is to do anything. So the quicker we can identify it, the better off. Now, this other one I'm showing you, this is BDNF. So BDNF is brain-derived neurotrophic factor. It is released through a variety of mechanisms that, and ultimately it's awesome, right? It helps modulate the brain, which is super important from an immune system perspective. It also protects the brain. It helps with synapses repair. So synapses are those connections. It also helps with neuromodulation. So brain function helps with plasticity. Plasticity is the ability of the brain to learn, to connect, and to make changes. And then last one is the blood-brain barrier is preserved, which is also critical. If the blood-brain barrier gets broken down, which happens in most Alzheimer's cases, then the battle is significantly harder, especially if people are getting sick or stressed and their brain starts going to mush. But this is what it looks like, right? So there's not one approach for preventing and reducing the risk of Alzheimer's disease and other forms of dementia. But there is a systematic approach that we use called the BMB method, brain, mind, and body method, right? We don't pick out our favorite system. We say, how's your brain health functioning? What's going to sabotage it from functioning the way it should by looking at body health, and then also looking at mind, such as stress response, past trauma, abuse, PTSD, and other things like that. Only when all three of those are evaluated appropriately can you have the best treatment plan possible to help you. And anything in those areas that is found needs to actually be addressed. If you don't address it and you're only doing part of it, that is like expecting to bake something and to have it taste a certain way, but you left out ingredients. It just doesn't work. So I hope you found this information useful. If you would like to work with me or one of my other team members in reducing your risk of going to Alzheimer's disease or other forms of dementia, as well as stopping the mild cognitive impairment in its tracks, which, you know, we do really, really well with mild cognitive impairment. There's a lot of things that can be done. You know, once again, it's a different story if you wait till you're a severe Alzheimer's patient. Unfortunately, maybe we slow it, maybe we do nothing. You know, that one's always harder because of the amount of damage that's been done. But once again, if you would like to work with us, I'm going to put below in the description as well as in the comments of how to do it. So, and I look forward to working with you. And if for any reason you can't, I still hope you found this information really valuable and you've gained some insight into what you can do to take control of your health, because that is the most important thing. Our brain determines who we are and what our destiny is.